When I talk about the term impingement with my patients, I'm like, if you don't have a cuff tear, you've got normal strength, you've got this pain, you probably have a combination of your rotator cuff tendon is inflamed, and then the bursal tissue between the acromion and the tendon is inflamed, leading to bursitis. I think it's probably the most simple way to describe it. The question is, how do we get rid of it?
Yeah, I mean, I'm with you. So I normally tell my patients, you might have heard it called impingement syndrome, bursitis, tendinitis. They're all the same, you know. But how do you get rid of them? Well, we always have to go to our staple. We mention it every episode. If you have good scapular motion and good scapular strength, so doing your physical therapy and having good motion overall is very important. These physical therapists are gonna love us when we're done with this. But then we go into other things. So this is another inflammatory condition. So, and that's, I think, where the way we look at it maybe differs from the way that some people classically thought of impingement syndrome, was that they blamed it as a structural problem.
Right.
And so since it's an inflammatory condition, we go back to all the things we've talked about for other inflammatory conditions. You can do things like oral anti-inflammatories and oral steroids. We can do steroid injections. You know, you can do PRP injections. There's a couple different options is the way we go. I always look at the other factors, right? I'm going to try to avoid NSAIDs and things like that in patients with heart problems and kidney problems.